There is very minimal risk associated with the block. With advances, we use an ultrasound machine, so we are able to directly visualize where is the nerve, where is our needle tip, so we are able to avoid direct contact to the nerve, and therefore the chances to any type of nerve damage is extremely minimal. If you have really good pain control, you should be able to get up early. If you have no nausea, vomiting, which is a frequent side effect of morphine or narcotic pain medications, you should be able to eat, drink early. And if it's all working out well, you should be able to get up, move around, and start physical therapy, so be on your way to early functional recovery.